Guys, for today's video, I'm going to be showing you the most essential, or one of the most essential pieces of equipment we have as paramedics. That is our cardiac monitor. So we use this monitor for vital signs, to check your heart rate, to check your oxygen levels. We use it in a cardiac arrest to shock. We use it in a fast heart rate to cardiovert, slow heart rate to pace. So there's all sorts of things you can do with this. Let me turn it on for you. So this brand is a Zoll. It's one of the more popular cardiac monitors. You see them all over the place. A lot of emergency services carry them. A lot of hospital emergency rooms carry them. I believe they were initially designed for combat use in the military. So they're very rugged, relatively lightweight, and have a lot of capabilities in terms of analyzing heart rates and that kind of thing. So I do have it hooked up to a shock box. So let's turn that on. This is a machine that simulates rhythms, and you can dump electricity into it to test your defib. So I have it set to NSR. As you can see, NSR, that is a normal sinus rhythm. So that is what your heart should beat like if you have a healthy, properly working heart. The electrical pathways are all working well. That's what you're gonna see. So that's what you'd like to see when you hook somebody up to a monitor. And let's check out asystole. So asystole is also known as a flat line. So in a lot of movies, that kind of stuff, TV, you might see the doctors or medics shock this rhythm. And let me just shut off this alarm. You might see them shock this rhythm. That is not something that's done in real world practice. So this rhythm, you would just continue CPR, you would give resuscitative medications, but you would not be shocking this. So if you want to see a rhythm that you would be shocking, let's check out VF. So that's a VFib, otherwise known as ventricular fibrillation. So you would shock this rhythm. Let's take a look at how we would do that. We'd go down, we'd select our energy. 120 is kind of a standard to start with, and let's charge that up. Okay, we're charged up to 120. You'd make sure everybody's clear, hands off the body, and then you hit shock. Boom, that's going to deliver 120 joules of electricity. So that would hopefully convert that heart out of the VFib. There's a VTAC, which is another shockable rhythm, so we would shock that. This, you could also be alive and be in this rhythm. There's medications we could give to get you out of it. There's something called synchronized cardioversion, which is a feature where it'll sync up a certain part of your heart rate, and it'll give some kind of like a defibrillation, give some electricity to try to shock you out of that. Let's take a look. What else do we got? So we have let's check out a bradycardia. So that's a bradycardia. Let's get it off sync. So that's a slow heart rate. So typically 40s, anything under 60 beats per minute is usually a bradycardia. Start getting concerned in the 40s to 50s, anything below that. And also you're watching out for their blood pressure. Some people have a low heart rate, 40 to 50, and they're completely fine. That's healthy for them. Just usually in athletes, and sometimes you can have a conduction delay in your heart, which isn't necessarily a serious issue. It can be, but that can cause your heart rate to beat on the low side as well. Okay, so that's kind of the gist of it. I mean, in the side here we have the vital sign stuff, so we could take your blood pressure, check your oxygen levels, all that kind of good stuff. And yeah, like I said, you can't really do a call successfully without a piece of equipment like this. Hope you guys enjoyed. Stay tuned for the next one.